If you feel a sharp pain when drinking something cold or eating something sweet, you may be experiencing tooth sensitivity. Sensitivity happens when enamel wears down or gums recede, exposing the inner layer of the tooth called dentin. Dentin contains tiny channels that connect directly to the nerve, which is why temperature or sugar can trigger discomfort. Common causes include aggressive brushing, acidic foods and drinks, teeth grinding, gum recession, and early tooth decay. While sensitivity may seem minor, it is often an early warning sign. It can indicate enamel erosion, bacterial imbalance, or developing cavities. This is where preventive monitoring can help. Salivary testing can identify bacterial risk factors that contribute to decay and gum inflammation. MouthCam allows you to capture clear images of your teeth and gums from home, so dental professionals can review any visible changes. Together, these tools support early awareness and informed decisions before problems progress. If your sensitivity is persistent, worsening, or localized to one tooth, professional evaluation is important. Do not ignore the signs. Early action can prevent more complex treatment later. Learn more about preventive monitoring at dentulu.com